Good morning. Happy Friday, everyone. This is episode 8. And when is it about the patient? We are very honored today to have Dr. Delianis, a plastic surgeon, here with Arrowhead Plastic Surgery as our special guest, our subject matter expert. Today, we'll be talking about plastic surgery, and we'll kick it off by asking the doctor, what education is needed to be a plastic surgeon?
I think a lot of people are surprised to know that plastic surgeons are probably the most well-trained, or at least at the top of the surgical specialties. So in order to become a plastic surgeon, of course, you have to do your 4 years of undergraduate, then you go to 4 years of medical school. Now it's changing just a little bit, but I'm going to go the traditional route because they are trying to change things a little bit. But then typically you do your 5 years of general surgery, which is when you go to have somebody who takes out your thyroid or your appendix or your gallbladder. Those are general surgeons. Trauma surgeons are general surgeons. So we do those 5 years of general surgery. Then we do anywhere from 2 to 3 years additional in plastic surgery. So it's 8 years essentially after medical school to become a plastic surgeon. Then you can go on and do additional training in hand surgery and cosmetic surgery. Even though that is incorporated in your original training, you can do more training afterwards.
Like
So it's a
specialized.
long road to specialize even more. It's a
Yeah.
9-10 year course after medical school, which is a long time.
That is a long time.
It
In
is.
comparison, like how long does orthopedic surgeon go?
So an orthopedic surgeon does 5 years
Okay.
after medical school to become an ortho, and then they can go on from there and do a year in spine or a year in hand or something like that. You could look at 6 years versus like 8 or 9.
Wow.
Now
That's
the difference though is plastic surgeons operate from the top of your head all the way down to your feet. We do every body system.
top of the head to the toes.
Um, so what I was saying is a lot of patients come to me, and if they come in for a hand fracture, they'll say, I don't know why I'm here. I don't need a plastic surgeon. I have a hand fracture, or I broke my hand. And I'll say, well, that's something we do. Or they'll say, I don't know why my doctor sent me here. I have a skin cancer, and I should be seeing a dermatologist. And the answer is no, we do the surgeries for that. So there's a lot of things that we do. If somebody were to have a traumatic amputation of a finger or an arm, it's a plastic surgeon that we attaches that. We do cleft lips and palates, of course. We do a lot of cranial reshaping for congenital deformities in kids. Plastic surgery is such a wide range of things that we do. And you need all that training to be a great surgeon to be able to do all those things.
Yep. And you kind of touched on our second question, is what would people be surprised to know that plastic surgeons do? And you just kind of touched on that. I do remember, because you said you were on call today, you get called in for, I remember when our kids were in high school that you got called in on a student's father who was in an accident, was burned, and
so
dealing
plastic
with
surgeons do burns too. We cover a lot of trauma. We cover facial trauma. If somebody has complex facial lacerations or facial fractures, we get called in for that. Another thing that a lot of people don't realize is when an open heart surgery has an infection and the sternum gets infected and the heart is sitting there beating in the air out in the wind, we come in, clean everything up, and bring muscle flap from the chest to cover over the heart. So there are a lot of different things that we do that most people don't really recognize us as doing.
No, because they think of cosmetic.
Yes.
And we do a lot of cosmetic surgery too. The problem with plastic surgery in the long run right now is that we have because of the cosmetics, and I'm sure we're going to get into the cosmetic because that's what everybody wants to hear about. Is the
right.
cosmetic stuff. But we have so many non-plastic surgeons that call themselves cosmetic surgeons or plastic surgeons. And, I went through that training that it takes. And in today's world, unfortunately, everybody wants the quick way out. They want the shortcut. They want the quick weight loss. They want the quick muscle gain. They want the quick way to make money. And we see a lot of, like, there's a radiologist in town that does cosmetic surgery that is not even a surgeon. He's not even trained in surgery. And he'll do breast augmentations and tummy tucks and things like that. Now his license has subsequently been suspended, and they're looking into more things. I don't want to get into that, but there are family doctors that are doing injections of Botox and fillers, and every spa on the corner has a nurse injector that is, injecting all kinds of things in people's faces. We get a call probably every month because, again, everybody thinks they're going to make this quick money, where we get a call from a provider that says, we were told during our class that we took that we need a plastic surgeon as a backup in case, one of the injections goes wrong. Will you be our backup? And the answer is no, no. If you can't handle your complications, do not send them to us.
Right.
But we get that a lot. There's an orthopedic surgeon in town that is injecting Botox and fillers. And there's a general surgeon in town who calls himself a cosmetic surgeon or a plastic surgeon. And he spent 6 months with a gynecologist that was doing cosmetic surgery. And he calls himself a cosmetic surgeon. Everybody wants to do the quick thing. And it just doesn't work that way. You have to put in the time, you have to build your skills, and you have to be able to handle the complications that occur, because everybody has complications. It's not because we're careless when we do surgery. It's just the nature of the human body.
Well,
Right.
there's salons that do injection, like a hair salon.
Yes, they do. So all you need to inject is you need a physician, plastic surgeon, a family doctor, anything, to be the medical director. And then you need either a nurse practitioner, or now they've gone to nurse injectors. So nurses can inject under the license of the physician. So like a lot of these spas, they have one doctor in Cleveland, for example, that runs 3 or 4 or 5 different spas in Toledo, and the nurse injectors inject in those areas. And as long as they're careful, and they follow protocol and their experience, the reality is they'll be fine. But again, everybody is injecting, and it's we'll look at some of the numbers, because my numbers don't even reflect that. The data that I have comes from the American Society of Plastic Surgeons. All the nurse injectors and the family doctors and the orthopedic surgeons and the dentists that are doing this, they're not even accounted for in these numbers. It's mind-boggling how big those numbers are.
Wow. And so what should a patient look for when they're seeking out someone to do a procedure or injections or anything, to know they've got a qualified person?
Sure. Honestly, it's the same every time. The American Society of Plastic Surgeons has been saying this for the last 50 years. You have to make sure that they're a board certified plastic surgeon, not a cosmetic surgeon. Anybody can call themselves a cosmetic surgeon. They can't call themselves a plastic surgeon if they have not gone through the training. It's illegal to do that. So make sure that they're a board certified plastic surgeon, and make sure that they're familiar with the procedures, that they've done enough of them where they can not necessarily handle the procedure, but the reason you want somebody who's experienced is so that they can handle the complications or the things that can happen afterwards. That's where the experience comes in. Of course, you want somebody that's talented and knows what they're doing, but you also want somebody that can handle some of the issues that can come up.
So if I go into like the database for license lookup, will I be able to ascertain if someone is board certified or no?
You can't. So if you look up my name, for example, it'll tell you, if you go to the American Society of Plastic Surgeons, the ASPS website, it'll tell you who's a board certified plastic surgeon. The problem is people don't do that. There's a lot of deceptive advertising. So if I'm a general surgeon and I'm board certified in general surgery, I can put on my ad for you, Botox injections, so-and-so dollars, board certified. Well, board certified in what? That's the problem. So it's very deceptive. There are deceptive ways. Like I said, like there are general surgeons, and it seems to be the trend now, because they don't want to do the extra 3 years that it takes to be a plastic surgeon. And their argument is, well, I don't need to do all the plastic surgery stuff. I just want to do the cosmetic stuff. So I'm going to go with this gynecologist and train with him for 6 months and call myself a cosmetic surgeon. Well, wait a minute. The gynecologist isn't qualified to train you. Just because he does a tummy tuck, for example, doesn't make him qualified to teach you or even do that tummy tuck. So it really is becoming a problem, and it's a huge problem in other cities. It's starting to become a problem in Toledo too, because we're getting these doctors that are starting to creep up, because again, everybody wants to cut corners.
Well,
So then do you see patients that have possibly gone to somebody and haven't had the outcomes they want, so then they come to your practice and want help rectifying issues?
We do, but it's very complicated. It's so complicated. We do. We have stopped doing as many as we used to because it's a legal liability. It really becomes an issue because once you start taking over the care of somebody who you need to be an advocate for the patient. And that pulls you into a huge legal battle if they decide to pursue legal action. And we as physicians, honestly, unless there's a blatant malpractice, we don't get involved in things like that because we know things can happen. I have had complications. As careful as I am, skin flaps die, patients get infections. Those are the things that happen. And you need to explain that to patients ahead of time before they have surgery and say, listen, here's the bottom line. You are a healthy individual that wants to either look better or feel better, but there are risks with this kind of surgery. Anytime we make an incision, there's a risk of an infection. Anytime we move tissue from one part of the body to the other, there's a possibility that tissue may not survive. You're a smoker, you've lost a lot of weight, so your protein levels are low. There are lots of factors that go into this. So it's a lot more complicated than just saying, oh yeah, come on in, we'll take care of any problem you have. We try not to get involved with it unless the patients absolutely need it.
Okay.
That's pretty standard too. Most specialists don't want to take over another
100%,
specialist's care.
100%, right.
I don't blame them, although sometimes it does put the patient in the middle, depending on the circumstances.
It is. But we're in such a litigious society that it makes it more difficult to get involved in somebody else's care because of it.
Exactly. Speaking of, you lost a lot of weight, with the huge surge of people taking the Wegovy and the Ozempic and the Mounjaro and whatever else. I'm sure that you've seen an uptick in people who need the excess skin removed.
We do. It's not as big a number as you think.
No.
The average weight loss, according to the data, is about 20 to 25 pounds. So, I tell all patients to take it. Yes, if you can combine it with exercise and diet, your numbers can go excessively high. I mean, you can lose 100, 150 pounds. But the reality is most patients think that they can just take the Ozempic or the Wegovy and just lose weight. And they do to some degree, but it's not massive numbers. But yes, we have seen a big uptick. In fact, I have some numbers from the ASPS just in tummy tucks alone. And they base their numbers off of 2019 numbers versus 2022. That's the last time they did a major overhaul. And that's actually even before the big Ozempic bump. But they're almost 40% increase in abdominoplasties just in those 3 years. That's an amazing number. They're looking at 162,000 procedures throughout the year or through the increase. Now, the problem is that doesn't account, again, like I said, for the non-plastic surgeons that are doing some of these tummy tucks. The weight loss surgeries where the general surgeon says, you know what, I can just take that skin off for you because they can try to get that through insurance. And we'll talk a little bit about insurance. And so it doesn't account for those numbers. So the numbers in general are staggering.
Does insurance pay for that?
So insurance is very tricky. Anybody that's ever dealt with insurance knows the insurance companies are in it to make money. They are not your advocate. Yes, they're there to take care of you in a catastrophic situation, but they want to keep their money just like any other business. Mm-hmm. So they say that if it is truly medically necessary, we will cover something called a paniculectomy. A paniculectomy is that skin that overhangs the belly area on the lower part that kind of gets to the thighs or the knees. So you can take that part off. The problem is that most patients don't need that only. That is they want a tummy tuck. They want to look better. They want to feel better. And then they argue with you because the insurance will allow only a paniculectomy and they want an abdominoplasty. So in our practice, we have stopped fighting with the insurance companies because at the end of every year, the insurance companies go through and do an audit. And sometimes, and I'm sure you guys are familiar with audits, they'll say at the end of the year, no, this has not been approved and that hasn't been approved. So, but they audit things. And then we're in a situation where we can't turn to the patient and say, your $3,000 or $4,000 surgery, you need to pay us in cash now. That's just not the way the insurance companies work. So we, as a practice, do not do any insurance-based abdominoplasties or paniculectomies for that reason.
That's probably a smart move because as I'm sure you know, the insurance companies will come back and take that money back from you.
That's exactly right. That's
Yeah.
exactly right. But I think that's pretty standard for most plastic surgeons. They don't do it through insurance.
So if people have to pay out of pocket, then my next question that comes to mind is this an outpatient procedure?
It depends on what you have done. Most abdominoplasties are outpatient procedures. It takes about 3 to 4 hours, depending on how much skin we take off. If you do a lower body lift, which is going all the way around, it's like pulling on a pair of pants. I mean, it's an incredible surgery. We do keep you overnight, one night, possibly 2 nights, so that we make sure that you're healthy. Again, it's all about safety. And that is the bottom line.
So that's expensive then.
It does add up, yes. But, a patient one time told me, because, I do question that too sometimes, that instead of buying a, $30 or $40, $50,000 car this year that's going to last me 5 years and then I have to turn it in, I am going to spend $20,000 on myself, and it's a lifelong investment. And when you put it into perspective like that, it makes sense.
Yep, that's a good point. If we could shift a little bit to the more cosmetic side, if someone was coming to you and they didn't know what they want to look better, they want something done with their face, but they don't know where to start or what to do. When they come and see you or someone in your practice, what's like the first thing that you kind of recommend, or how do you start that process with someone?
So just like everything in life, we start it's like a pyramid. We start with the basics. We start with skincare, sunscreen. And as far as skincare goes, I can't even keep up with all the new products that are out there. It used to be the hyaluronic acid was the big thing. Then they went to vitamin C, and then they just keep it. And I think part of it is a marketing ploy. They try to get, once the market is saturated with a certain product, everybody wants the next biggest and newest thing. So they bring something else out. And unfortunately, it's very Hollywood and now TikTok driven. Kids, they really do what they see on TikTok. My daughter will come up to me. So I'll give you an example. We use something called Aquaphor, which is an average over-the-counter moisturizing cream that you can buy. We use it on our burns. We use it on our laser resurfacing. And she says, "Dad, have you heard about this new Aquaphor?" I said, "Aquaphor's been around forever." "Well, it's on TikTok, and you need to do this, and it makes good skin." And it's all about the fad of the time of that moment. So, you have to be careful. You want things that work for people and that are lasting. You don't want to just keep bouncing around with every new fad that's out there, because that makes you just like a yo-yo type of practice. And that's not what we are. But on the other hand, perfect skincare, good skincare, sunscreen, those are really the way to go. Then from there, we can go to laser resurfacing. So basically, like I said, it's a pyramid. The higher up we go, the higher the cost is, and the more downtime you have. We talk about fillers, which help. We talk about Botox. Fillers are things you inject under the skin to help build, and if you have lines or grooves that you want to fill, if you want to augment your lips. They're invasive, but they're not as invasive as a major surgery. Botox is a neuromodulator. It paralyzes the muscles so that your frown lines aren't as pronounced. Then we go on to things that are more invasive. We can do surgery on the eyelids. We can do a facelift or a neck lift, liposuction under the neck. So it's kind of a graded scheme. And we present everything to them because not everybody wants what we may think is the best thing for them. They may want to just kind of work things up. I hate to sound like a car salesman, but when you buy a car, you have your options there. You can get the night vision, you can get the interactive cruise control, you can get all these things on your car. Do you need them? No, but every time you add something, it brings the cost up. It's back like in the old days. You either had hand cranking windows or you bought the electric windows. And as time goes on, all those things get more and more expensive by the time you add them on. Well, the same thing can happen in our office. We give you the option. We go through with everything. And I think most plastic surgeons are like that.
So how long does Botox or fillers last?
So Botox lasts about 3 months. Now, it's a little arbitrary because it's not exactly 3 months. For some people, it lasts a little bit longer. For other people, it lasts a little bit less. If you've never had Botox before, your muscles will recover a little quicker. The longer you use Botox, the more the muscles have been paralyzed for a longer time, the more they're atrophied, the weaker they get, the longer the Botox lasts. So, it's a combination of things. Fillers, on the other hand, the ASPS says that they last about 12 months, or at least the manufacturer says they last about 12 months to 18 months, but they have a little caveat in there. They say 12 months with a touch-up will take it 18 months. So typically a year, I think, is a good way to see it. Now, I have seen patients that have had repeated injections need less and less and less because there is some ingrowth of tissue and a little bit of scar tissue in that area that kind of gives you that bulk there over time. So it really does work well.
Well, that was a question related to that too. Like, what is the long-term effect of using something like Botox? If down the road you decide you don't want to do that anymore, does your skin fall off or anything?
Not going to fall off.
Okay.
No, it's not going to fall off. If you stop using it, your muscles just kind of get stronger and they get back to where they were. It's not like they get hypertrophic. They don't get thicker than they were before.
Okay. Good to know.
What's the most common facial surgery?
So I pulled up some numbers here. Believe it or not, and I think it makes sense after I explain it, eyelid surgery went up 13% to 120,000 procedures. That is the most common facial surgery that went up. So I think with COVID and everybody wearing masks, all you saw was this much of people's eyes. And I think people just, and these numbers may change again. Like I said, right now, these numbers are based off of 2022 numbers because they do their evaluations every 2 years or so, where they send out questionnaires to the plastic surgeons for their numbers. Now, this does not include eyelid surgery done by ophthalmologists or what we call oculoplastic surgeons, who are ophthalmologists that do an additional year just for the exterior part of the eye. But eyelid surgery is the number one. So part of it is like I said, the COVID effect, and I can understand that. It makes sense.
Well, and we were all doing Zoom meetings where we had to sit and look at ourselves. So
you look at the way the lighting is and the way it falls, and everything looks like shadows. My daughter worked from home for a while, and she said, "Dad," which is where I'm at right, "your office is terrible. I look like I'm 100 years old when I sit in the office." And I can see what she's talking about now when I look at it. Look old. I mean, I am old, but you look older.
Do you think breast implants are as popular as they were 15, 20 years ago?
So the number one cosmetic surgery, according to the ASPS, is liposuction. 325,000 procedures. Now, that again does not include, I have to add this caveat because this is for board certified plastic surgeons. That's up 23% from 2019. So that's liposuction. The next biggest cosmetic surgical procedure is breast augmentation. It went up 4% from 2019 to 300,000 procedures. So the answer is yes.
Yes.
It has gone up and it will continue to go up. If you think about it, we really don't have any other way to give volume to somebody's breast. We can take tissue from other parts of their body, and they've started doing some fat injections. The problem with fat injections is with the whole breast cancer scare, you don't want to inject fat into a breast tissue, and then you have areas that become lumpy because you do get some fat necrosis with fat injections. So breast implants are still by far the only reproducible way to give volume to somebody that has some decreased volume in their breasts.
And have the implants gotten a lot safer, Dr. Delianis, with materials that are in the implant?
Okay, so safer is kind of a strange word because the reality is, and again, I can only go with what the FDA says.
Okay.
When the breast implants we had our breast implant scare. They took all the silicone breast implants off the shelf. You could only put saline breast implants in. So then instead of doing a retrospective study, which is looking backwards, they did a prospective study and they looked forward and they said, okay, women that are saying they're having these collagen vascular diseases like lupus and Sjogren's and all these things that are happening, is it a higher percentage in women that have had breast implants? So instead of looking back, we're going to take women and put them in a study. So if you're going to get a silicone breast implant, we're going to put you in the study and we're going to follow you forward. And they studied them for a very long time, and they found no increase in the population versus, or the breast implant population versus the regular population in those collagen vascular type diseases, the autoimmune disorders. So when you say, are they safer? Breast implant technology has improved. The breast implants are a little stronger. They're a little more cohesive, so you don't get as much gel, but they found that they've always been safe. They didn't find any correlation with breast implants and an increase in autoimmune disorders. Does that make sense?
Yeah, that's really interesting. We would be led to believe otherwise. So, yeah.
But there is one type of breast implant, and it's a textured breast implant. It's not a very common breast implant. They used to put them earlier, probably about, I've never used one. So about 10, 15 years ago would be my guess. But they did find some very rare cases of lymphoma with the textured breast implants. But those are not very common implants, and they have taken those off the market.
What about an increase in women having them taken out?
So I think what happens is part of it is education. I tell all my patients the breast implants do not last a lifetime. And, I'm 50, I think I'm 56, 56 years old. You blink and time goes by. So when you tell somebody who's young that these implants will last 10 to 15 years on the average, for them, 10 to 15 years is a lifetime. And then before you know it, the implants are here. So then they have the option to say, okay, do I replace them or do I just leave them out? So I think that is part of the issue, is women are taking them out and not replacing them. But as you can see, the numbers keep going up. So it's not that women are taking them out and not replacing them.
Yep.
Gotcha.
Is a while ago, Botox was a treatment for migraines, or they advertised that it was. Is that something that people come to see you about? Is that still a thing, or
So we do not do it,
not really
and probably most
so
plastic
much anymore?
don't do it. But it is a treatment for migraines. So the answer is yes. It is a very, very effective treatment for migraines. The problem with Botox is you need a lot of units. So typically about 150 units for Botox. So insurance will pay for some of it. They don't pay for all of it. And there are some patients that pay out of pocket for their Botox treatments. So we don't do it at our practice, but there are a lot of neurologists or even some family doctors that do Botox treatments for migraines, and it is effective.
Where do you inject that at?
So there are so many different places you have to inject to really effectively get a good Botox treatment. You do inject in the forehead, you inject in the neck area, in the back of the neck, you inject some areas on the scalp. It's wherever those tension areas are. So there's lots of different places. Like I said, I don't do it, so I'm not by in any means an expert at it. But there are multiple injections, and it's very high volume.
Wow.
Small amounts, lots of injections.
So you say family medicine does this?
Some family doctors will do that, yes, especially when they do, family doctors can tailor their practice to a lot of different things. And if they are migraine specialists or something along those lines, they can do it. It's not everybody, because again, some insurance reimburses it, some doesn't. And you don't want to get stuck with this huge bill for the Botox.
Right, because you got to pay for that up front.
They have to pay for it up front. That's correct.
Exactly. So now, nowadays there's so much emphasis on skincare. I think more so than like say 20 years ago. I grew up washing my face with dial soap. It is what it is. And now people are like, oh no, don't use soap on your face. Are there like some standard things that people should know about their skincare that like I always think if you just have a good process, a good routine that you do religiously.
I really think it comes down to, yes, keeping it clean and then moisturizing. Moisturizing and sunscreen, I think those two. And here's the other thing that a lot of people don't realize, it's smoking. So if you eliminate smoking, moisturize, and use a daily skin regimen, like you said, you really should do well. Unfortunately, then we fall into that last part, which is genetics. If you have good skin, you're going to have good skin. If you don't have good skin, unfortunately, there's not much you can do. But those three things, avoiding the smoking, lots of moisturizing, and avoidance of sun or sunscreen application, that is the key.
Good to know. Is there anything that can be done? Well, we touched on some of it, to the face without surgery, like,
Yeah, I think the three main things are Botox, fillers, and then laser resurfacing. So what laser resurfacing does, and there's so many different lasers on the market. There are lasers that target the water in your cells. There are lasers that target the red blood cells or the chromophores in your cell. There are lasers that work like little aerators that are fractionated. So there's so many different products out there, and I can't tell you that one is better than the other. You know, it depends. It's really patient specific and what you need. But laser resurfacing has been a godsend for a lot of patients. Patients that originally thought they needed a facelift can get by with a laser resurfacing, which has significantly less downtime. It's cheaper, and it really just smooths the skin. A patient once told me when she was applying her makeup, it felt like she was going on a cobblestone road, and after laser, it was like on a smooth highway. And that's a good way to put it. You know, if you take all these creases and you smooth, it's not going to make your wrinkles completely go away, but it does resurface the skin. It does smooth it out a little bit.
so can you go out in public after you have laser resurfacing?
Depends on a couple factors. It depends on how deep the laser goes. It depends on whether it's fractionated or not, because that only burns a portion of the skin at any given time. So most patients can have their laser on a Thursday or a Friday and be presentable on a Monday, but they'll look like they've had something done. It takes a good week or two. And some patients, depending on how deep you go, even at a month, they're still pretty red. So it varies. I mean, you can put makeup on, but it really has been a godsend for so many people.
What percentage of your business do you think is elective, like cosmetic?
Well, I get that question a lot. So the problem is this: about half of my practice is cosmetic, but it accounts for about 80% or 90% of our income, if that makes sense.
Yeah.
You know, you do a lot more of the other surgeries like skin cancers, hand fractures, carpal tunnels, but they don't account for as much of the income as the cosmetic part does, which is, again, goes back to that original thing that we talked about, why everybody wants to jump on that bandwagon. Because cosmetic surgery is on the rise, cosmetic surgery is lucrative, and everybody wants to do it. And it's the patient who ends up suffering in the long run.
Well, it's self-pay, so you don't have to deal with insurance
Correct.
and working to get your money.
That's
And
correct. It makes a big difference. And you guys are from the hospital side of it. You know that you have to fight for every dollar. I mean, if you think about it, if you're going to make $40 or $50 from taking a skin cancer off of somebody, by the time you pay your nurse, you pay your biller to do the billing, you pay your biller to fight with the insurance companies the number of hours just to get that $40. A $300 Botox treatment seems like a godsend when you compare it to it. But that's why a lot of doctors are kind of switching their way over.
well, because it doesn't matter what specialty you're in, every doctor across the board is fighting with insurance companies to get paid for the work that they do.
They are, and that's why you're seeing that a lot of your family doctors are starting to be bought up by larger hospital systems.
Carrie?
Yeah. Can you hear me?
Yeah.
Okay. Dr. D, I think you froze again.
Now he's back.
Yep.
Did I drop out?
Yeah.
So you're saying that there are not a lot of independent practitioners out there, and you're fighting for reimbursement, but then you get all these government mandates, and electronic health records is another one.
Oh gosh, expensive as heck.
Oh my gosh, it's so expensive. And if you're in a private practice, you're looking at $150,000 to $200,000 just to implement it, plus the licenses that go along with it every year. It's very expensive.
Oh, it's outrageous. And that's the problem. And so that's why, when they implemented electronic records, some of your older physicians said, I'll practice a few more years. I'll pay a fine if they fine me. And then I'm going to ride off into the sunset.
And a lot of them did.
Yes, because they couldn't do it. the electronic records just drove them nuts. So another thing is, if you're an employed physician, you don't have to worry about all those things. Someone else is paying all your bills. All you need to do is go to work, do your job, and someone else takes care of all those things. But the health systems too are fighting to get paid for everything. It's
They do.
it's everywhere.
Yeah.
Have you seen an increase in men getting procedures?
I have, there's a difference. So the answer is yes, but there's a difference in the type of procedures. So most women carry their fat external on their hips, on their bellies. So when they lose weight, you get more skin hanging. Men, on the other hand, have more visceral fat. They carry their fat. If you want to think of the old like beer gut or beer belly, where you get this big guy with a big belly, most of their fat is intra-abdominal. It's visceral fat. So when they lose weight, yes, you do get some skin hanging, but it is not the same amount of skin as a woman would. So we see a lot fewer men with abdominoplasties and things like that than we do with women, even though they have the same amount of weight loss. On the other hand, we are starting to see more men with facial procedures, their eyes, Botox, fillers, because as we get older, we have to compete with the younger market, and that's essentially what happens. And Zoom had a lot to do with this, because you're looking at yourself while you're sitting here, I'm looking at you guys on this camera because I'm not used to looking at it. But the people that are used to doing these Zoom calls are looking at themselves and they're like, wait a minute, look at this. I could do something with that. I need to do something with this. And that's what they're looking at while other people are talking in a meeting. They're looking at themselves. And, so they have to compete with the younger crowd. They want to look better.
Right.
They feel they have to.
Yep.
That's true.
The one thing that, from my standpoint, that it just boggles my mind is this whole lip craze. I do a lot of lip fillers, but I'm a very conservative lip filler. I want people to look good. I never want somebody asking a patient of mine, who did your lips, with the intention of staying away, because we have seen some ridiculous lips. They're filled like this and all over TikTok, and a lot of the celebrities, their lips are just ridiculous. Something that we would never in a million years have considered to be attractive has become attractive to this different group of kids. And it just boggles my mind. It blows my mind.
I think Elisa Rena, the actress, is like Botox gone bad on the lips, because hers are just, but
there are so many actresses that look so beautiful and now they just look ridiculous. And it's a stepwise process. I don't think they realize how ridiculous they look. I'll see people on Facebook that'll post something, and you look at them and they're people that we know, and they'll say, well, I finally found an injector to do what I wanted. And I'm looking at these lips and I'm thinking, oh my gosh, why would you think that that was attractive? So, everybody wants what they want. I'm very conservative. I want people to look good. I want somebody looking at my patient and saying, wow, you look really good. I just don't know why you look so good. That's really the mark of a great plastic surgeon.
yeah, so they don't look like they've had anything done.
That's exactly right. They look refreshed. Their lips look fuller. They look voluptuous and beautiful, but they don't look ridiculous. Or their face looks more refreshed, like they're not as tired. They're not as tired around the eyes. That's the mark of a great plastic surgeon.
I was just reading some stuff about plastic surgery before we did this call, and I read, and I didn't realize this, it said that your lips thin as you age.
They do,
Is that
especially
true?
the upper lip, kind of disappears. And if you pay attention to yourself, even my lip, when you look at it, it just kind of disappears over time. But that's volume of fat. There's fat in our lip too, and then there's just volume. If you look at our cheeks, our natural face is more of a curve. We have something, if you're into countertops and things like that, you know about an OG curve on the edge of the countertop. This is an OG curve here. We have our cheekbones, and then we kind of hollow out a little bit here. As we age, this becomes drawn. And then this line from here to here is not a curve that comes down. It's more of a drawn out look. So by injecting filler in here We give a little bit of a youthful appearance. We don't have to give them big rosy cheeks, just a little bit of a contour here and a little filling in the lips, maybe a little bit something around the eyes, removing some of the excess skin. And that's also all it takes many times to make somebody look much more refreshed and not as drawn out. Injecting the marionette lines helps a lot. Again, as we age or even lose weight, they start to hang a little bit more, filling the nasolabial folds. And all of these things have reduced the number of facelifts that are essentially necessary, which is not a bad thing.
There you go, Carrie.
Yeah. Yes. I mean,
Hey, why did she call you out? I think you're beautiful.
get new glasses, Dr. D. I think it's people want to look more natural, or I think that's what looks pretty. When all these celebrities look so overdone, it's
Well,
just
it's kind
it's
of
not.
taken a turn because people don't want to look natural anymore. Some of the older patients do because that's what they're used to. Some of these younger kids, they want to look ridiculous. I don't understand it.
Yeah.
I don't either, but I don't
But
try
that's
to
because I'm
understand.
old, I guess.
You and me both. I don't try to understand everything. My grandma used to say, don't try and understand everything. Some things will never make sense. And she was right.
Yeah.
I want people to look good. That's the bottom line. And I
Right.
want to make sure that I'm not the reason that they look ridiculous. So,
Exactly.
and I tell people, if this is what you want, you need to go somewhere else.
That's smart.
Yeah. Yeah.
Carrie, I'm out of questions. Do you have any?
Yeah, I think we've covered everything. Dr. Dalianis, is there anything else you'd like people to know, or do you think we've covered pretty much the
Um,
game?
No, I can just encourage people to make sure that they please do their homework. Check things before they go in. Just because this person is on TikTok, there's a plastic surgeon in Columbus that was so popular on TikTok. Kids would come from around all over the place to go to her. And, she was very dangerous in the way she was doing her surgeries. She would videotape these while she's dancing and looking at the camera.
Oh, there's a neurosurgeon like that too. She
Yeah.
she dances and she does videos of like her staff dancing with her. And yeah,
Yeah, you want to make sure that the person that you're going to is 100% invested in you at the time of surgery. Because, if you're focusing on where the camera is and how the camera makes you look and whether you're dancing, or you want to focus on taking care of the patient. That's really the bottom line. And you want to make sure that the person is qualified and certified to do what they say they can do. Check their credentials. Make sure they're a certified plastic surgeon. Make sure that they're board certified. I can't stress that enough. It's getting worse and worse because we as a society want the quickest, cheapest. And that's the other thing. If you really think that trying to save money on plastic surgery is where it's at, that is not, we have a saying that, why would you trust your body with anyone else? And that's really the bottom line. Why would you go somewhere based on money? Because if you're looking for the cheap, you're going to get what you pay for. And that's really the bottom line.
that's true.
Yeah.
Well, thank you for having me on.
Hey, no, thank you. We appreciate it.
Of
That
course.
was
Good
great.
luck with everything. And it was very nice seeing you again, Carrie.
You too.
Very nice meeting you, Chris.